Okay, now we're going to talk about hepatitis. Hepatitis is inflammation of the liver that's caused by either a viral infection or maybe chemical toxins, most commonly viral infections. So that's what we're going to focus on today. Now, the danger with hepatitis, when we're talking about B and C, is that they can become chronic. When somebody gets chronic hepatitis, we're worried about them then getting cirrhosis and then getting liver cancer. Okay? So we really need to protect people from getting hepatitis by good health promotion and prevention efforts. Hepatitis C, there's a high prevalence in my age group, the over 60 age group. And the reason is when we were coming of age, sex safe wasn't the same as it is now. HIV hadn't emerged at that time, so we didn't worry about getting HIV at that time. So, really the only reason we were practicing safe sex is because we didn't want to get pregnant. So now, people my age, maybe they're divorced, maybe they never got married, whatever, don't have to worry about getting pregnant anymore. So they're not having safe sex. And that's why there's a rise of sexually transmitted infections among people my age. Okay, let's talk about hepatitis now. We're going to focus on A, B, and C. These are viral hepatitis types. Your book goes into D and E versions. I'm not going to go into that because D piggybacks on B, so it's the same thing. And E is transmitted the same way as hepatitis A. It's fecal oral. All right. So the incubation period is different for each one. For Hep A, it's 2 to 6 weeks. For Hep B, it's the longest. It's 6 to 24 weeks. So by the time somebody gets it, they may not even remember who they got it from, just saying. And then 5 to 10 weeks for Hep C. Now, the mode of transmission, you're definitely going to have to know that. For A, it's fecal oral, and I remember A is for anus. That's how I remember that. B, it's transmitted through blood or bodily fluids, so I remember blood and booty fluids. So, like through sexual contact or through, infected needles or infected blood products, sharing needles, I should say. And then C is the same as B, so that makes it easy, right? Examples of how the virus is transmitted. With A, it could be eating raw shellfish, not washing your hands after using the restroom. It could be spread through anal sexual activity and contaminated fruits or vegetables when you're traveling. Always drink bottled water. Never drink a drink with ice in it. And to prevent hepatitis A, good hand washing. You want to have safe sex. And for all of these with prevention, you don't need to refrain from social drinking, okay? Because when I get into if you get hepatitis, you can't drink for like more than a year, okay? So with hepatitis B, some examples, it could be transmitted through infected saliva or semen or vaginal fluids, but not through urine or feces, not through tears either. Organ transplants could transmit B and C as well. To prevent A, I talked about that. So to prevent B, safe sex, sterile needles, needle precautions. They don't need to avoid alcohol unless it's excessive. Excessive alcohol could also result in inflammation of the liver. Some other comparisons involve vaccines. There are vaccines for hepatitis A and B, but not for C. Immunoglobulin, this provides passive immunity, and you can get it before you travel to a country that has a high prevalence, or if you're exposed, you can get immunoglobulin. So only A and B has immunoglobulin. If you get A or B, you will have lifelong immunity, but you have to remember that B and C can be chronic. Okay? So the risk of liver cancer is going to be increased in B and C. First, they'll develop cirrhosis, then liver cancer. So look for an elevation in the ALP. The good news is the expected findings in hepatitis are the same no matter which type of hepatitis somebody has. So typically the patient's going to complain of abdominal pain in the right upper quadrant, and that makes sense because that's where the liver is, and the liver is going to be extremely inflamed. So then they're going to be tender to palpation, even light palpation. They're going to have a fever because they have inflammation, nausea and vomiting. That's a GI sign. Lethargy because they have inflammation of their liver, so they feel very tired. They don't feel good. They have malaise. It's like coming down almost like with the flu when they first have these symptoms. Arthralgia. Art refers to a joint, and algia refers to pain, so painful joints. And myalgia is painful muscles. Those are common signs and symptoms with all types of hepatitis. If there's biliary obstruction due to hepatitis, the patient is going to be jaundiced and have icterus. They'll have dark foamy urine, clay-colored or white stools. They'll have intense pruritus. I mean, so intense that they really scratch themselves silly, and they have excoriations. So you may have to put a pair of gloves on somebody that has intense pruritus, and make sure you're not using soap. Like you want to use a mild soap and tepid water, not hot water, when you're giving a daily bath. And they'll have elevated AST and ALT, the troponins of the liver, and ALP, alkaline phosphate, and bilirubin will also be high. And that's true in all biliary obstruction. They all have the same signs and symptoms. A patient may undergo a liver biopsy for any type of liver disease where they need to make a definitive diagnosis. It's the only way to make a definitive diagnosis of liver disease. So the implications for you are the patient needs to be MPO after midnight or 4 hours prior to a liver biopsy. Depends. In case they need to go to surgery, they need to be MPO. And then witness the informed consent and be present at the timeout. They're definitely going to need coagulation studies pre-procedure. The liver receives about 1,500 milliliters per minute of blood flow. So it's highly vascular is what I'm trying to say, and hemorrhagic shock is one of the complications of a liver biopsy. Okay? Instruct the patient to exhale and hold their breath for 10 seconds during the procedure when the provider needs to do the biopsy part. That's to prevent the patient from getting a pneumothorax. You should remember from MedSurg 1 that a neurothorax is when the lung collapse. So you're going to watch for those signs and symptoms after the procedure. So signs and symptoms of a pneumothorax include increased work or breathing, so increased respiratory rate, not being able to hear lung sounds on that side, dyspnea, persistent shoulder pain, and pleuritic chest pain. If you recall, pleuritic chest pain refers to pain with breathing. Usually it's on inspiration. Monitor for bleeding and signs of shock. The first sign you're going to see is tachycardia, increased respiratory rate. They'll be complaining of thirst, and they'll have confusion, tachypnea, and a low BP. Remember, tachycardia is always first. You want to keep the patient on their right side post-procedure to enhance coagulation, okay? So in other words, your liver's on the right side. You're going to turn them on the right side to try to minimize bleeding.